Hello guys, welcome back to my YouTube channel. From this video I will discuss about the normal wound healing in the skin. So there are 4 stages of wound healing. First phase is hemostasis, second phase is inflammatory phase, then third phase is proliferation phase, fourth phase is remodeling phase. As you can see here, there are 4 phases of wound healing. First, we will talk about the hemostasis phase. In hemostasis, there is disruption of vascular endothelium due to injury. So, what happens is there is vasoconstriction as well as exposure of subendothelial extracellular matrix due to disruption of the vascular endothelium. And then platelets get adhere into the particular site and they activate and they further aggregate platelets forming a platelet plug. So you can see in this picture as well, there are platelets here. Those platelets come into the site, the injured site, and they get adhered and they get activated, then they get aggregate and forms a platelet plug. Once they activated, they release granules, and then those granules release growth factors like platelet derived growth factor, fibroblast derived growth factor, vascular endothelial growth factor, and epidermal growth factor. Once those growth factors are released, there is deposition of the extracellular matrix and there is angiogenesis as well. Next phase is the inflammatory phase. We will discuss about the inflammatory phase from this diagram. So when we talk about the inflammatory phase, day 1 to day 2 is known as early inflammatory phase. In early inflammatory phase, there is platelet activation and there is influx of neutrophils. Here you can see there is influx of neutrophils into the injured site. Once the activated platelets in the injured site release histamine and serotonin, there is increase in vascular permeability as well. Then day 2 to day 3 is late inflammatory phase. At that phase, there are the monocytes appear in the wound and differentiate into the macrophages, and phagocytic cells release proteolytic enzymes as well. The next phase is proliferative phase. The proliferative phase starts around day 3 and it lasts for about 2 to 4 weeks. Actually here there is fibroblast deposition. Here in this diagram also you can see there are fibroblasts. From this fibroblast there is formation of granulation tissue and type 3 collagen. In early part of this phase, actually there is formation of granulation tissue, and the latter part of this phase there is increased tensile strength of the wound due to increase in collagen. Actually here there is increase in type 3 collagen. And then the final phase is remodeling phase. Actually, this remodeling phase begins 2 to 3 weeks after the injury and it lasts for about 1 year or more. In this phase, there is maturation of collagen. Actually, there is replacement of type 3 collagen which deposited by fibroblast in the proliferative phase to more stronger type 1 collagen. Here, there is more stronger type 1 collagen. In normal skin, the type 1 to 3 collagen ratio is 4 to 1. After about 3 months or 12 weeks, there is this injured site or the healing site have 80% of uninjured skin strength. 80% of uninjured skin strength. So those are the 4 processes of 4 phases of wound healing: hemostasis phase, inflammatory phase, proliferation phase, remodeling phase. The hemostasis phase lasts for about the first lasts for about 24 hours, and inflammatory phase lasts for about 1 to 3 days, and then from around third day, proliferative phase starts and lasts for about 2 to 4 weeks, and then remodeling phase starts at 2 to 3 weeks after the injury and lasts for about 1 year or more. So I hope you clearly understood about the phases of wound healing. So thank you for watching.